Good afternoon. Before I start, I'd like to, particularly for those of you out of town, to indicate that Rob Ford, we apologize for his behavior. We don't take any responsibility. He doesn't necessarily reflect our values.
Not necessarily.
Some of them, just let him do his job. I'm pleased to present the following highlights from my report and encourage you to read it in full. In the past year has been an exciting and productive one for OASW as we have taken on an increased number of activities and initiatives in an attempt to enhance the value of membership. By way of example, considerable staff time and resources went into the planning, implementation, and evaluation of the biannual provincial conference in November of 2012, which Kate has already referenced. It was sold out and the feedback was highly, highly positive. Staff have also been working with an external consultant on an initiative to highlight the value of membership, increase engagement of members, enhance services, and raise the association's profile. And we're very excited about this initiative as it begins to roll out over the coming year. After years of lobbying, we were very gratified by the decision of the Canadian Revenue Agency in September of 2012 to approve clinical social work services as a medical expense tax credit. This means that social workers are now authorized medical practitioners for the purpose of claiming medical expenses on income taxes. And it's in many ways symbolic, but to the public it is helpful to be able to claim those services. OASW's news bulletins continue to serve as a vital communication vehicle in relation to the association news and key issues of interest and concern to the profession. On average, approximately one goes out about every 4 to 6 weeks. Also, a number of practice-related virtual groups remain popular with members as a way to network, share information and resources, and discuss practice issues. In 2013, the association launched a new pilot format for OASW News Magazine. The new online OASW News Magazine is a slimmer, digitalized publication containing one or two brief articles followed by OASW News, and this is often in relation to awards. In summary, I'd like to give a special thanks in recognition of the commitment and hard work of OASW's Board of Directors and Executive Committee, advisory groups, and related committees. Also, I would like to thank the team at 410 Jarvis, and especially want to recognize Jillian McCloskey and Rita Masherin, who served with me as a senior team at the office. Together with the efforts of the board, the committees, and staff, it has been a highly productive year, and I thank you. Kate, do you just want me to stay up for the government relations? Okay. Okay. Government relations remains a key priority of the association, and OASW has continued to work closely with Policy Concepts, a government relations firm, to assist the association in understanding and navigating the complex context within which public and social policy is formulated. OASW's Government Relations Advisory Committee, chaired by Dan Andre, has continued to refine and implement the association's government relations strategy. This government relations strategy has focused on strengthening relationships with ministers, fostering relationships with MPPs, working with government to remove barriers to practice, promoting equitable access to services for clients, and branding social work as cost-effective, particularly as an alternate to medical approaches to health care. Key to this approach has been the development of briefing notes to support and refine our messages, particularly related to the value of the profession, the cost-effectiveness of services, and increasingly we are emphasizing our traditional roots in the community as our population ages and as services increasingly will be delivered in the community. I thank you.
Thank you, Joan. And also, I'd now like to invite up Karen Nelson, who is the Vice President of Social and Professional Advocacy, and going to give the highlights of her report.
I'll talk first about the social advocacy efforts of OASW. OASW has been working actively on your behalf to bring about social change and trying to advance and highlight the needs of those people we serve on a daily basis across Ontario. The advocacy efforts this year have been largely led by Gillian McCloskey very ably and have included such things as addressing issues related to homelessness and poverty through advocacy regarding the elimination of the C-sum-B and participation in pre-budget consultations as well as submissions to the review of social assistance in Ontario. We've had some very good results, some meetings with the Premier and other officials, and very positive response. We've been using the social determinants of health to underline for the government how social workers can improve health status and health outcomes. As well, the advocacy efforts have included highlighting the need for reform of the social assistance system through participation in the ISARC forums. This enables OASW to have conversations with ministers and deputy ministers and advance the issues that we care about. They have also been working to support the work of the School Social Work Committee through multiple activities that bring school social workers together and help to further their needs and their issues so that they can be addressed in a macro way. With respect to professional advocacy, there are many activities that have taken place over the past year, some of which have been alluded to by Kate and to Joan. There's been a lot of consultation with the Ministry of Health and Long-Term Care regarding the implications of the Psychotherapy Act for social workers. You can read about some of the impact of those discussions and the highlighting of those concerns in your report. They have been advising the college in terms of opinions regarding the draft policy guidelines for psychotherapy. They've been advocating with the Ministry of Health and Long-Term Care related to the role social workers can and should be playing as part of the senior care strategy led by Dr. Sinha. They've been preparing role statements related to specific areas of healthcare practice, and these will be useful to all of you in your places of employment and will help to inform employers of what the unique roles of social work are. There's been education through the successful provincial conference, as well as the promotion of the annual Social Work Week materials and information posted on the website. You saw one of the posters that's been used during Social Work Week, and again, those materials have helped people to celebrate Social Work Week. And there's also been a research collaboration on the quality of work life together with the Faculty of Social Work at U of T and the Canadian Association of Social Workers and Educators. Altogether, these activities seem like a small number of things, but they require immense amount of time, persistence, and education in order to further the goals of the organization. I'm going to speak now about the Nominating Committee. I have the pleasure to serve on the Nominating Committee with an able group of members from OASW, which have included Monica Orbach, Gloria Ackroyd, Sharon Evans, Louise Gauthier, Mary Kay Lucier, Alison Shurko, and Joan Mackenzie-Davies. We've been pleased to have a number of people come forward, raise their hands, and be eager to take part in the work of the association, which made our work as a nominating committee so much easier. We didn't have to twist as many arms as sometimes we have had to. There was an election, and the results of the election mean that some new people are coming forward and taking new positions, as well as some people who have been on the board at previous times. Elected to 2-year terms, we have the Vice President of Branch Affairs, Kathy Farrell. The Vice President of Social and Professional Advocacy position will now be filled by Ellen Sue Mesber. Other people on the board for the remaining 1-year term will include Kate as our President and Keith Adamson as our Treasurer Secretary. We also have regional representatives who've been elected to 2-year terms. These include for Central Ontario Region, and if you're here, if you can just put up your hand so people see who you are. Christina Van Sickle. Welcome, Christina. From Northern, the regional representative from the Northern Region, Alison Shurko. Alison. Back again for a term in Southeastern Region, representing Southeastern Region is Julie Galthorpe. Julie here? Not yet, not yet, okay. Back again from Southwestern Region, Patrick Fleming. The other members of the board who will be serving on your behalf in the coming year with 1 year remaining in their term include from Central Ontario, Rashad Vahed. Is Rashad here? No? All right. From the Eastern Region, Bonnie Schroeder. From Hamilton, Niagara Region, Ruth Bikus. And our Francophone director who's not able to be here today, Martin Supranant. We're very delighted that the position of student director continues to be held by Shira Moalam. Is Shira here? No? All right. Thank you very much to all of you who came forward when we called for people to work on behalf of the association. I wish you much success in your work in the coming year.